Okay, the geniuses will see us now.
I'm a pro.
He's very unprofessional.
Very unprofessional.
These are our newly arrived surgeons, Doctors Trowbridge and Greenbaum.
Doctor?
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 We're not doctors.
Are you sure they can handle this?
Oh, we can handle it. We're professionals.
You'll forgive us if we're not instilled with confidence.
Potentially unprofessional pieces of content.
Okay, we're starting. Hey, another week. Stop coughing. Another week, another dollar, I guess.
Up?
Even though it's been like a month.
Yeah, it's been a long time.
Yeah, dude.
We came out with 3 episodes hot last month at the same time. And then...
Life got busy, man.
Life
what
got
can
busy.
you do?
Yeah.
Everyone's got stuff to do.
We had our shelf exam for internal medicine.
Yeah.
We had other things going on.
And then everyone's splitting up now.
Everyone's splitting up now?
Yeah.
What do you mean?
Because...
Oh yeah, I know. We were all together in the same rotation. It was like an episode of Scrubs or something. It was great. And then now we're all
everyone's
in
going their own
places,
different ways, man.
Well, especially in the ER, we never see you guys. A good point is like anyone who goes to the ER, they're not seen for like months.
Man, I don't like you.
You don't like it?
No.
That makes me so happy. Do you know why? Because it means like, oh, like I actually like it then. You know what I mean? Because like if people I know and like, they don't like it, then it's like, oh, okay, I really liked it. So it must mean that I was in the right spot, you know?
I think it's very specific for like a certain type of personality.
Yeah.
And maybe I'm wrong because what's my girl's name? I don't know. Fuck it.
Anastasia.
Yeah, sure.
She came up with
Let's just use the first letter of everyone's name from now on.
No, you do that and I don't, it doesn't connect.
Okay. Anastasia, whatever. She likes it. And she was like going through a crisis of like, oh, do I want to go to ER now or anesthesia?
Oh, wow.
Because when she first came in, she wanted to do ER. And then she did like surgery and she liked anesthesia. And then now that she likes ER, she's like, oh shit, do I want to go back? But it doesn't really like fit with like my personality. I don't understand how she likes it. And
also, I don't get how people like anesthesiology and ER. And that's a common theme, I feel like. But
you do a lot
they're
with your hands.
so fucking different.
Yeah.
I feel like they're so different. In anesthesia, you sit in a chair most of the time.
You don't do anything in anesthesia.
And in ER, bro, you're going ham.
Yeah.
Like, I don't know. That's just so different to me.
I think anesthesia, you just have to use your hands, intubate, lumbar puncture, whatever the fuck, epidurals, which is a lot of ER, but also in ER you're diagnosing. So I guess it's less work for like the same amount of money or whatever.
It is.
But
you have to be like dumb to go to do the ER. Like, not dumb, but like, what are you doing? Like, why are you going there?
Here's all the things I do like. I fucking love IVs, and like, dude, I'm getting so fucking good at IVs. The first time a nurse showed me, I was really nervous, and then like I kept going, and now it's at the point where like I don't have to see the vein. If they're young and they have good veins, I can get it. Old people, like, fuck, I can't do anything. But I'm pretty confident that I can get like everyone we know our age.
Oh yeah.
For sure.
Nice.
Funny thing is Anastasia has done 0 successful IVs.
No way.
Yeah. It's so funny. We get like opposite like experiences because I never get to present patients and she always gets to present patients. So she's been like presenting to the attendings. I've talked to one attending, the black lady. I don't remember what her name is, but she like doesn't give me the time of day when I present. I presented her.
She didn't give me the time of day either.
Okay, good. So it's everyone.
Yeah.
I was like, why is she ignoring me?
She's not just racist or anything.
I didn't think she was. I just think she doesn't give a shit about students, honestly.
Yeah, no, she doesn't.
So
a quick story about her. I went up to her. And they're like the resident. This is one of my first times presenting, but resident's like, okay, present to the attending. I'm like, oh fuck, and I have no idea what this illness is, how to present anything because it's OBGYN stuff, and I just haven't gone over that yet, and so I'm just fumbling through the whole thing. And at one point, she stops the presentation, the attending, and goes. She looks at the resident. She goes, "He wants to do ER? Are you sure?" Like, deadpan, and I'm like, "Oh man!" And the resident's like, he's only a year 3."
First rotation, whatever.
All right, continue.
I don't even know where I was, but fuck it. No one like really lets me present, and I don't know why. Like patients come in, but like no one asks me. I'm always there. I'm like, hey, any patients? No one says anything, or no one gives me anything. So I ended up like just fucking finding some cool nurses, and I'm like, if you need IVs, tell me, or if you need whatever. And so
that's how you do it. Yeah.
I've
Sounds like you're doing everything you can to do stuff. So.
Yeah.
It is what it is.
They give me good reviews though. In the evals, they say motivated. So I'm like, okay, like I'm asking you guys, but I don't know why they don't give me patients. So I've been doing a lot of IVs. I probably do like 5 or 6 like every day. I haven't got to do compressions yet. I've been shitting my pants when it comes to like someone coming in with the code.
Dude, yeah. I mean, you just, it's like anything else in life. You just react when it happens.
And I'm like,
and if you think about it a bunch before it happens, it doesn't really help you.
Yeah,
I mean, sometimes
you just gotta do it,
Right.
And I know that the way to get over it is just do it once, and the next time it's whatever.
Right.
And you can't fuck up. They're already fucking dead,
Yeah, and that's a good point. Like, it sounds harsh, but it really, you can't fuck up CPR. Like, you can just, you can not do it perfectly, but you can't fuck it up.
Yeah.
Like, as long as you're just slamming on their chest, like, someone gave me a tip while I was doing CPR, and this lady that was dying, but she was just like, hey, more of like a tempo or some shit. I forget what she said, but I was like, okay, so mid CPR, I'm like, getting critiqued. Like, oh, okay, sounds good. Yeah. Like, how's your day?
How many times did you get to do CPR?
Just once. Wait. No, twice.
Okay. Did you like put it in like your eval?
Yeah.
If, like you like put on the blood pressure cuff and shit.
Like that. Those like little things.
Yeah.
I don't think I wrote them down.
Okay, I didn't do that either.
Yeah.
I didn't want to get a signature for that. I'm like, what the hell's the point? Like, I can put.
But I didn't write down as many things as I should have on the eval. Like, I could have done a bunch of stuff, and I didn't realize that's how it worked. But whatever.
Well, good thing.
All that matters is how the attending feels about you, especially when he's writing.
Yeah, like this rotation doesn't matter unless you want ER. Like, I'm just trying to learn whatever I can.
Dude, yeah, you can learn a ton from it though. Yeah. It's ER,
you gotta do a lot of shit.
Right.
It's been fun, but I don't like going to it. If I could do IM instead, I would do that, basically. But basically what I've learned is after this first week that I'd rather just do the same job with more time and not all this like running around shit. So it's solidified that I want to do IM. That is what
it is. It really is.
And you gotta follow them and everything, so it makes it more like flowy, you gotta like follow them throughout their stay in ER. You like, okay, they have this, send them up, okay.
Yeah, that's the sad part about it, is you don't see them anymore after you send them away. Like, they're there, you do all this stuff to make sure they're all good, and as soon as they're stable and stuff, they're just, okay, I don't know what happens to them. I don't know if what I did was even, like, helpful. Yeah. Like, anything.
Man, we had this lady come in. We were, like, doing compressions for, like, 10 minutes. All right, the paramedics brought her in, and so, like, we're like, okay, it's time to call it, guys. She was found in, like, apartment lobby, just like face down, well, not face down, sorry, on her back. She was cold already, so she was like already dead. They didn't get ROSC or anything, like return of circulation. And so we're doing it, and then finally it gets called, and they're like, okay, we need to check her for trauma, and they check her. There's a big fucking hole in the back of her head.
What?
Her brain's coming out of it, and we're like, we should have just done that before. Like,
what?
So the cops came and they're like, we found a bullet casing, and she got shot in the back of the head, and so the bullet went in, and there was a big hole, and then here there was like a fracture, or whatever, the bullet coming out, in the front of her head. And yeah, there was like no saving her. I don't know. Like, paramedics should have probably like looked at it,
That's crazy. Yeah, I'm surprised the paramedics didn't see. That's surprising.
Because like, man, basically the entire fucking ER shut down. There was literally 2 attendings left in like to run the ER. All the residents, all 4 of them, and I think 1 or 2 attendings were in the room, and a bunch of nurses.
It seems unnecessary.
Yeah, it was way too much. But anyway, what are you in, peds?
And another thing, I wish we knew why they got shot in the face. Like, that's nice.
Oh, she was pregnant too, so we're like, oh, that could have been something to do with it. But it was ectopic, so she wasn't gonna like have that baby anyway.
Damn, it's still all that's very crazy.
Yeah, she probably had a positive pregnancy test, and her boy was like You gotta
Wow,
go.
really assuming there.
Yeah.
But yeah, no, I'm gonna assume that.
I've made the connections already. I've thought about it. I was talking to the cops about this. They're like, you could be our youngest detective if you want to come to the force. And I was like, I'm good.
Bro, first week of peds. I know this isn't interesting to the podcast, but I have to talk about it.
Which part are you in? Which week?
Which week?
Yeah.
Oh, we were in Well Baby Nursery for the first one.
Man.
Bro, it was wild.
With the fucking crazy
Wild.
doctor?
Dr. Oh, shit, I gotta... What time is it?
No, 10 minutes almost.
Okay.
9:55. We got pretty far without saying anyone's
Yeah,
name.
it's not bad.
Not her, but the other short guy that's crazy.
Oh, Indian guy?
No, the other guy.
Oh, I haven't seen him yet.
Oh.
Yeah, I think he's been off for the week or something.
You got so lucky,
Really?
dude. Oh, he has like a disorder. He has little man syndrome for
Oh,
sure.
this is the guy you talked about in, I think, the first podcast, or maybe the second one.
Yeah,
Yeah.
probably.
Yeah, I know.
Because we all hate him.
Oh,
No
okay.
one goes through and says we like him. Because
Oh.
he takes us like at 4:45 and he keeps us for an hour
Oh,
lecture.
yeah, you told me about that. No, Dr. G, though, is a boss.
Yeah.
Do you like her?
I love her.
Bro, maybe the best attending I've worked with so far. I'm not even kidding.
Oh, that's pretty far.
Dude, she, like, pulls us aside, teaches, and, like, does it in a good way, and, like,
Yeah.
is, like, harsh when you get things wrong, but, like, generous about it. Like, it's just the best of all
Yeah.
worlds. So,
Yeah,
and
she's
she
great.
obviously gets her shit done.
Hmm. She
Yeah,
said she'd
she's
write me a
great.
letter. I was happy about that.
Oh, really? And you asked her?
Yeah.
Oh, she's a boss.
Yeah, she's really good. She's basically the only good part about that rotation.
Yeah, I agree so far.
Yeah.
I mean, it's been crazy. Like, they have you do so much, and
They
when
have you
you're-
do so much?
Bro, well, we don't do that much, I guess, but we're Group A. You have to do a 45-minute presentation week 1. I mean, I entered. What time is it?
11:30.
God damn it. Frankie and the other girl, they both had tests throughout the week. So I was on my own, and there's only 3 people in our group. So I was like alone for several of the days, or like
What?
with just one person. And so and it's just been packed, bro. There's been like 4 well babies each
Oh my
time,
God.
and a full NICU. So we're just like going ham, and like the doctors don't really have time for us, but they're still teaching us somehow. Oh man, Dr. P, do you like him?
He's very strict, but I like him.
Don't like him.
What does he do?
Don't like him. Oh my god.
You have to be perfect for
You
him.
have to be perfect, which is fine. I'm fine with that. And he's like more strict, also fine. And he's more of like the, traditional way type way, where it's like you do something wrong and you should be scolded, or that kind of thing, just like the old way things are done. All fine. If anything, I like those kinds of things. But he's just so condescending to me. And he literally, I don't know whether to take this as good or bad or what, but first thing he says to me is, not the first thing, but he's like, "You're conservative, huh? Like you're that's what he said." I'm like, "What?" And then he just went off about that for a bit. I'm like, I've talked to you for like 10 seconds, my guy.
Oh my god.
So,
How do you
yeah.
get that?
I have no idea. Yeah, he looked
kind
at
of
the
a
person
mystery.
with tattoos and long hair and was like, "Yeah, this person's conservative for sure."
We had literally one baby the entire week.
That's crazy.
A well baby, and Anastasia was the one who did it. She went up to like go see him or her, and she was like, worst experience of my life, because she went with the crazy doctor that's not there this week. So you're lucky you don't have him, because however bad Dr. P is, his name starts with a C, so Dr. C is like 10 times worse. That's maybe why I like Dr. P, because like
you had the worst to buttress it.
even Dr. P doesn't like him.
Wow.
Yeah, we asked to leave early once for like because we had a presentation, and he's like, "Don't tell Dr. C," but yeah, you can go. And I was like, "Did I hear right?" And I was like, "What did you say?" He's like, "Don't tell him." And I was like, "Oh, okay, so I did hear you right." That's how you know how insane it is.
Amazing.
I feel kind of bad though, for like taking time off for step 2, because now I gotta wait longer for like my rotations to be done. I want to do a sub-I before I did ERAS, but I guess that's not gonna happen.
Yeah, a sub-I is like a
Sub-internship.
Yeah, sub-internship, but it's like a specialization of internal medicine or something.
Yeah, basically.
Yeah.
Well, you get more responsibilities and stuff, but yeah. so ERAS, like September 29th is the date or something, where like residencies can start looking at your programs this year. But you can submit them September 1st. So I think I'll still be in psych. I'll be finishing psych. In October, I have like, I'm going to try to book something soon. And in November, I have my sub-I, so that's kind of lame.
You know, one thing I've considered with the podcast is there's one of two things. With one, we're going to try next time, and that's like a video. And then we'll just like really conceal ourselves. But the other thing I was thinking of is like, and I have zero time for this, obviously, but like having like animation or something, or like some kind of like visual thing for it to go along with it, but obviously impossible.
No, that sounds awesome, but I'm like
it would be sick though. I have all these ideas and like you know, all these images. I'm like, damn, not only would that be dope, but like it would work. Like, like that would be the
best way. That's the best way I feel to like do a podcast. Because that way you can like make a, you know, like a TV show of like what you're describing.
Right. Exactly. And here's the thing, like us, even if it was video, us talking about Dr. P, Dr. C, Dr. G, that means nothing to anyone who hasn't been there, unless you have actual visuals that you can pull up. Yeah, like it's a fucking.
We can like make him look like
right. It would be so sick, and you could do anything you want with it. You know, like Dr. G has like a halo above her head, and then Dr. C has like his like fucking devil horns or something. You know what I mean? Just like goofy shit. Like that would be awesome.
Yeah, Dr. G is great.
We would just need it'd be dope. Like if you had the right, if the perfect like number of friends in the perfect like niches, you could do anything you wanted. Like if we had just happened to have an animator friend who just needed work and like was like, you know,
was willing to work for free,
open-minded and didn't need much, but like would be willing to work for cheap or free right now, but like realize that the dividends in the future could be great. But obviously that's very specific. But dude, if you had that friend, I know, like that would be wild.
That's why you need to talk to people.
And then that also brings up the point, like you could go find that friend somewhere. Like there's someone like that right now somewhere, and we're in New York, so like that's likely.
I'm sure fucking Abraham knows people like that.
Yeah,
'cause he's in the artistic industry.
Yeah, I wouldn't. Yeah, I don't know. I feel like Abraham's friends probably aren't the most productive people in the world.
Yeah, it was funny. He said he was working on like a
This is already funny.
A short like series or something.
Oh shit!
And he's like, one of my friends was a cameraman, but he just like didn't want to do it anymore.
Oh no!
And they're like, we had Corona time, you know, we're gonna get all this shit done, but he just dropped out. And I fucking hate that. But
that sucks. Yeah.
Yeah, it's whatever. So he probably knows someone who can do it.
Yeah, and that's one thing with us. At least we'll be, or at least a lot of people in the medical field, like, you know, if they say they're in, like, to do something, it's more likely than just, you know, you're run-of-the-mill person, I guess. But even then,
I would disagree with that.
You disagree?
Yeah. We started a project back at SU. There's like 4 of us, and Raj was one of them. We don't have to block out that name because there's like probably 1 billion of them. And he was the main guy for it because he knew how to code and everything. So we're gonna make an app about SGU and like, you know, the fucking restaurant. But we didn't have a clear vision too, because Mike, you don't have to cross that out either because there's like a million Mikes. Mike was like, we need to turn into question back. We need to turn into questions. You know, I would only use this app if there was questions. But I was like, bro, before I came to SGU, I knew fucking nothing, you know, about what the island was like or what anything was like. And so this is just have all the information like restaurants, currency, you know, blah blah blah.
That's so funny. Before you can go on, I was thinking the exact same thing, but doing like a newsletter or something with all the same information.
Oh, really?
Yeah,
that's probably easier.
And what I would do to make it worth anything or worth any money is like have advertisements from all the local areas. All the, you know, if like, okay, you need your tire changed. You know, I didn't know where to go, so it takes care of that stone. You know, it's 2 birds with one stone. It takes care of like, oh, now I know where to go if I need a tire change, and it's like the advertiser gets to you. You know.
Yeah.
So yeah.
Free fucking lamb wraps from
right.
Greek Kitchen or whatever.
Right. Yeah, and all the deals you can get on the island and shit.
Yeah. So yeah, basically we started that. My job, first thing we were like gonna get information. I went around to like all these restaurants and like got information and shit. And fucking no one did anything. Raj like lost interest. I think he has ADHD, like actually, or whichever one is like you can't focus. Because he like, you know, dropped off like altogether. Like he didn't message once in like the Slack we had. He didn't like give out any ideas, so it kind of like fell apart.
It's also, you have to gauge people for like how interested they actually are, or whether they'd be willing to see that type of a thing through. But that's hard to tell, you know.
He said he made an app for something else in undergrad, so we thought like he could do it, but
a lot of people just talk shit too.
Yeah, but he said he made money on it too.
$3.
I don't know. He said we were profitable. I was like, okay, you're like, you know, you're an undergrad, and how much money is profitable? You know,
yeah. What's your cost basis? Like $5, and you made $6.
I don't know what the hell it was. Yeah. So what topics did we have for today?
Let me see. I mean, it was kind of just like various things. I think with the next one, we like actually have like a planned thing. You know, we should do like the drugs. How we feel about them. You know what I mean? Like, should you take Molly in the morning, or should you just like?
Or is it more an afternoon?
Yeah, is it more of an afternoon drug? You know, does it put holes in your brain, or does it? You know.
Man, I want to try all these like hallucinogenic drugs.
Yeah.
The ones you can't get addicted to, I just want to try them.
Well, I mean, you can kind of get addicted to anything.
I guess, but like whatever ones don't.
Yeah, like you don't get like
dependent.
physiologically dependent on it, right? I don't know, other how about thoughts on the public opening up and not needing to wear masks anymore?
Man, I can't wait for the day that I don't have to wear a mask anymore.
That'll be nice.
This is so stupid. Like, people are giving away fake vaccine cards and shit. I'm like, what the hell? Like, it's kind of stupid.
Is that actually happening? People are giving out fake vaccine cards?
Like, some chick, it was on Reddit. Some chick was like, took a picture of herself like selling fake vaccine cards to like advertise or some shit. And I think she lost her job, but I'm like, why are you selling them? Just get fucking vaccinated, or people are stupid, man.
Yeah.
But I like it. I'm probably still gonna wear a mask at the hospital though, because like, man,
I feel like I'll wear a mask in the hospital afterwards. Just, I don't even know why. Because bottom line is we're vaccinated. It doesn't matter.
But there's
so why would we? But I will.
Other shit out there though.
I guess.
Man, some of these homeless people come in, they smell so fucking bad.
That's true, bro. I bet I've been spared from a lot of smells in the hospital.
Yeah, exactly. Like, I went into a room.
Even people's breath,
dude.
Let alone fluids secreting from homeless people.
Yeah, like hospital, you don't know where anyone has been, and I think that's enough just to keep wearing the mask, and I probably will. You know, Wong goes all out, and we don't have to cross him because there's probably like a billion Dr. Wongs. Wong goes all out with his like respirator and shit.
Oh, yeah,
that's what I should have in the ER, because we had this guy that came in for like a code. He had like cardiac arrest, and they were doing compressions. He smelled so fucking bad. I was about to throw up, and I was the one who was like supposed to put the blood pressure cuff on him, and I was like, oh,
it's got that medieval miasma coming out of him.
Dude, it was disgusting, man. I was like about
Bro,
to
I love
go
it. The places that need stuff the most, they use them the least, and the places that need them the least use them the most. Like,
what do you mean?
Dr. Wong going full respirator. Like, I get it. But then in the ER, bro, they don't even want to wear masks down there. They eat in front of a COVID room like it's fucking nothing.
Luckily,
which is kind of wild.
We haven't had like any COVID cases, but like, dude, some of the fucking residents are like retarded. They're so stupid.
They do
some guy came in for fucking COVID, right? And so they were like discussing whether or not to do D-dimers. And you know, on the floor, COVID patient, you always tell them what the D-dimer is. And so Anastasia was telling me that they decided not to do D-dimers because like the PE score, the Wells Geneva scores were low. And I'm like, what the fuck are you doing, man? You always
COVID, yeah. Well, I think like the regulations for like the hospital or whoever sets that, they said you should do D-dimers on every COVID patient.
I don't know why. Like, it's fucking one test, man. Like, you're already getting all this blood. Just send one.
Yeah, I don't quite get the point of not doing it. There must be some negative effect of like too many tests for the residents. I don't know what. I don't know.
Who the fuck knows, bro? But I'm like, he's getting admitted for COVID, and you're not gonna do a fucking D-dimer. Like, what the hell? But that's what the other thing I don't like about ER is that they know about all these things, which is good. But it's like they know until like you admit them, and then it's like, okay, I don't know.
And that bothers me too, and I hope I don't end up like that. But I know like that's what happens to every ER doctor, just because you specialize. That's how the world works.
You're specializing in like the first
general
stage,
acute
whatever.
First parts of every illness.
You have to stabilize and like move them on. I get that, but
Yeah.
It's just kind of stupid.
It's too bad, yeah.
But one of the guy, the SU third year, do you know what I'm talking about? The resident?
I think so.
He's gonna be making a shitload of money, dude. He's going and working in 2 ERs, because you don't have to work 10 days a month, right? Or something like that. So he's gonna be working 20 days a month and making like $400,000 plus.
Wait, say all that again. So,
From where?
from like the first second of the podcast.
Okay. So this third year like guy from SU, he was telling me about like his plans after graduating, which is soon. And he said, I have 2 jobs lined up in Phoenix, and he's going to be working in 2 ERs because you only have to work 10 days a month, like per job or whatever. So he's going to be working 20 days and making $400,000 plus per year.
That's a lot of hours.
Yeah.
Bro, you're doing 12-hour shifts, right?
Yeah, 12 hours.
So he's working 20 out of like 30 days in a month?
Yeah, but he's going to do 10
hours?
10 off and then 10 on.
Okay.
I don't know how he's
Why even work at 2 hospitals, and why not just double up for one hospital?
I don't know. I think it's like some guideline or some shit, because a lot of people do that. You have to work at like 2 different hospitals rather than just one.
Very weird.
Yeah, but ER you can make a lot of money, man. If he takes no breaks, he's gonna make a shitload.
Yeah, and I guess I'll work hard in the beginning too, but I don't know. Why do that for a sustained period of time?
I know. Like you should just like take some time off and travel and shit and start working.
Yeah, I'll probably be chill at first, then I'll work super hard and make some money, and then I'll be like, all right, life isn't about money. You know?
It's about experiences.
Yeah, I'll go full Abraham.
Abraham, man, his life is just so funny.
It's a freaking movie, man.
He's for sure rich.
Oh, there's no way. You don't just live in a nice apartment in New York without any job and just say you're an artist.
He was practicing, juggling the other day, and like he had to do his 2 workouts daily to get ready for summer.
I love it, bro.
He's gonna go get facials and shit.
I've really warmed up the idea of Abraham.
Yeah. What else is on your list?
Let's see what else is on the docket.
I don't know why we didn't plan anything when you had.
Well, here's the thing: we had a month without, like, first of all, me and you even communicating, but a month without being on the podcast. So like, there's a bunch of things we're just gonna be throwing out there, which we've done the first like fucking 20 minutes or whatever, and so we're going to get that stuff first. If we started like a list of drugs, we would be like intermingling it with a bunch of bullshit, which would be great, but like, I don't know, why not just save that to the next one?
Yeah. You know what was funny?
Huh.
I came here the other day, maybe last night or 2 nights ago, and I saw shoes. And I saw literally size 3 baby shoes. And I'm like, is Keegan like hooking up with a kid or something?
Jesus.
The shoes
Come
are
on,
so
man.
small. Oh wait, I'm Keegan. No, you're Keegan. You're my
I don't remember. And here's the thing. I saw a video of someone was like a fake, or like, dealt cards, but like, rigged it, like was super good at shuffling stuff and rigged it so his buddy would win. That was like his like profession or whatever. And he's like, you first have to come up with a fake name, right? Because you don't, if you get caught, you're fucked. You come up with a fake name, but it has to be close enough to your actual name that you can remember it. And we don't remember ours at all, right? It's because they're completely different than our actual name. And like if someone says that name, you have to react immediately to it like it's your name. And we don't even know ours.
I don't even remember what mine is. I think
it's Keegan and Trevor, right?
I'm Trevor.
But here's the thing: I should be Trevor, right?
Yeah.
And you should be something
Ken.
else.
Ken comes to mind faster now. So.
It doesn't make sense though, but okay.
I know it doesn't, but
all right, man.
So why was this?
Why was there a child here?
Why were their shoes like so small?
I mean, she's not. Okay, she's a Chinese foot binder. Okay, she binds her feet. Yeah, no, it's not.
Damn.
No, I mean she's small first of all, but I don't know. I guess she just has small feet. I don't know what to tell you.
They looked Too small.
She said her feet are so small that she obviously goes to Baby Gap, the baby store or whatever, and gets them. But she says they're so cheap that she just buys tons of dope shoes. So she has no, I'm not. I'm not even kidding. She buys she has 30 pairs of shoes for fucking $15. I'm like, dang, that's kind of sick.
Initially, I was just gonna make a joke about how small her feet were, but it's so funny.
The reality's even better.
Yeah, reality is better than a joke.
Yeah, no, I mean, small feet but big boobs, so we're okay.
Man, that's the best. There's one nurse in the ER. I probably shouldn't say this, but whatever. I'll show you her name, but she's this Filipino chick. She's tiny, but she's big boobs. So whenever she's leaning over doing IVs, I'm don't.
I'm trying to think of who you're talking about, but nothing comes to mind. I mean, that sounds like my type, so I feel like I'd be all over that.
Yeah. She works the night shift, 7 p.m. to 7 a.m.
Interesting.
Oh, I know what it is. It's fucking Nurse Santos.
Yeah, that doesn't ring any bells. Honestly, I didn't know a lot of the nurses' names anyway.
Okay.
But
you would have known her boobs for sure.
Yeah, I feel like you could show me and I'd be like, oh yeah.
Yeah. I was trying to look her up to show you, but fucking I couldn't find her anywhere. It's a very common name that she has apparently. Yeah. But yeah, hence
why it will be present on the podcast.
Yeah, but she's been pretty chill. I like that she comes and gets me whenever there's fucking IVs to do.
Yeah, that's good, bro. I have to broadcast it. I'm a fucking walking advertisement. If anyone needs IVs, you can come to me.
Boo! I was such a slap in the face. This fucking chick or one nurse. I was like, hey, if you need IVs, let me know. And she's like, yeah, I'll let you know. 5 minutes later, she goes up to another nurse and she's like, hey, can you do this IV for me?
Well, here's the thing.
Man.
She might have been doing that because she couldn't get it and was trying to go to someone who's better at IVs.
Yeah, maybe.
That's a big reason that nurses even put it out to other people.
Man, there's that trick that you do. If you can't get blood in the arm, try on the foot. In the ER, it doesn't work.
In the foot?
Yeah.
I've only done the hands. I've seen nobody do the foot in the ER.
We did it once. And I don't know why no one does it, but I think it's probably because circulation isn't great in the foot in a lot of people. But there was one person whose veins were non-visual.
There's always somewhere you can go in the hand if you can't
That's
get
the thing, man. We couldn't find anything. And then so we tried the foot, and
that's last
a
case.
Nice fucking vein right here and the medial part. And so we put the needle in and we got a lot of blood. And so I was trying that trick on this other old lady, and her veins, how they have fucking saggy skin and shit, you can't see anything. We were trying on her, couldn't find it. I was like, let's try the foot. And she has fucking lymphedema.
Oh wow.
Couldn't see anything.
Little elephantitis bilaterally.
Man, some people are gross. You know how they have that flaky skin that comes off? Man, nothing creeps me out more than that.
Hyperkeratosis.
I don't know what the fuck it is. I think it's a type of psoriasis or some shit.
There was one time, Dr. I, the resident, we were this patient was coding or some shit. We needed an IV. We couldn't get an IV in anywhere. The nurses were trying, blah blah blah. Arms, hands, feet. We looked everywhere. Legs, and then she's just spots a vein just straight up on the neck, and it's kind of here, and she's reaches over the head hits it, pulls it, and it was good. Everyone's yeah.
What the fuck?
Yeah, it was kind of wild.
Man, the thing in the ER is fucking crazy.
Yeah, ER is great.
And everyone there's all these homeless people that come in and they're like, I need a CAT scan. Yeah. I don't know why they want it.
Radiate me.
Yeah, I was asking my dad. I was like, why do all these people homeless people come in? And he's like, they just have nothing to do.
Yeah.
So they're like,
what would you do if you had nothing to do all day?
I don't know. I've never experienced that before.
Go to the ER.
But they want to go get fucking CAT scans. One of the guys I always see at McDonald's, he holds the door open and he's like, hey, any change, buddy? I saw him at the ER. I find it hard to believe that he needed a bone scan for his knee clicking.
I need a lumbar puncture. I think
Yeah. That's so
but bro, you've been sitting in the cold all day. People have been spitting on you and shit. Wow. You got $15 from trying to get money all day, and you're drunk. You walk into the ER, it's nice and warm. You get a sandwich, nice pat on the back.
Yeah.
Some cute medical student girl takes your pants off, and and they say they give you a little attention. Why not?
Man, I started to get fucking annoyed. Did you ever get frustrated at the patients?
For sure.
I wanted to fucking yell at this guy. He was so fucking annoying.
I yelled at one guy.
Did you?
Yeah.
What happened?
It was, I mean, I don't know where it came from, to be honest, because it wasn't that bad of a thing. And there was way worse things I experienced, but didn't yell at them. But this guy had kidney stones. I think it was just how he was coming off. Like, it wasn't just like, I'm in pain, help me. It was like, I'm in pain. You guys suck. Do more. You're not doing enough. Type vibe. And I was with one of the residents, the one who yelled at me. But I respect him. I like him. And we were just working through it. And then he said something finally, and I'm like, "Look, we're trying to help you, man." And that's that. I yelled at him like that. And the resident just looks at me and goes like this. He just, simmer down type of look. And I'm like, all right. And then he's like, and then he just took it from there, and he's just like, where's the pain? He kept repeating that.
Man, I don't know how they keep their tempers. I wanted to fucking kill this guy. I literally, I know it's the opposite of what I'm supposed to do. I want to kill him. I want to grab his neck.
You're supposed to make them alive.
But he was so fucking stupid and, so annoying to deal with. He came in passed out. He had ants on him because he was, fucking sleeping under a bench.
Ants in his eyes, Johnson.
Did you ever... Rick and Morty? Basically. He was wasted. I took a quick history. He was didn't know where the fuck he was. Didn't know what year it was. And
year is it?
We gave him some time to sober up. And I was like, we need blood. He's like, no, thank you. And he had fucking stitches on his eye for some reason. I'm like, we need to take those out. And he's like, no, thank you. All right, denying everything. I'm like, why the fuck are you here, bro? Go home. And I think he was homeless, but I'm like, why? What were you doing before this? He's like, drinking. And he had vodka in his pocket.
You sure he wasn't sucking dick? Why were you doing that?
He had a thumb out.
Oh.
Unless it's a small.
See, that'd be a great animation for the podcast.
What was I saying? Oh yeah, he said he was drinking. I'm like, why are you drinking? He's like, yeah, I got a divorce.
It's because my life is a wreck. Oh, he
yeah.
actually said that. Okay,
yeah,
damn.
He's like, I got a divorce in March. And I've been drinking too much since then. I was like, why'd you get a divorce?
Did you
He's
start
like,
crying?
Because, yeah, a little bit. He's like, because I drank too much. And I'm like,
wait.
Fucking stop, bro.
Wait. So he was drinking because he got divorced, but he got divorced because he was drinking?
Yeah.
Which one, chicken or the egg here? Which one started first?
Man, it's so fucking annoying. And anyway, I did not give a shit about this guy because... And it sounds so bad.
Yeah, and a lot of this sounds harsh, but
I'm just a
see
student,
so
okay?
many of these people as well.
And it's not my job to save them anyway. But anyway, he wouldn't give blood. I'm trying to take his fucking stitches out. It's past due. He should have had them out a week ago. But he's not letting me do that. He's just doing nothing. He's just sleeping. And then we fucking finally got some food and he's having a sandwich. He didn't eat the crust.
It's like you're I thought beggars can't be choosers,
yeah.
But you're literally choosing.
And then he literally keeps fucking calling me over. He's like, can I get another sandwich? I was like, ask your fucking nurse, I'm not the one who controls that. And he ended up leaving anyway, after he got his fucking second sandwich. But I'm like, what am I supposed to do for you, bro? You don't want to give any fucking blood. We don't know how you're doing. We don't know anything about you. You're not giving any information. And all you want is a fucking sandwich and to go. Okay, man, people like that, I'm like, we can't help you, Anyway, that was the most annoyed I've been was with that guy because the fucking residents kept telling me to go talk to him and get his fucking stitches out. One of the doctors came and was like, weren't you going to take the stitches out? I was like, he won't let me do fucking anything to him. And I wanted to hit him. I was like, hey, let's go to the bathroom so I can fucking kill you, bro. And he wouldn't
go to the bathroom to do that?
Yeah, I don't want anyone to see.
Oh.
Yeah, he was probably one of my most annoying patients.
We had, for peds, Dr. G comes up and it's just like, have you seen delivery before? I'm like, no. She's like, come. I'm like, okay. I'm like, I don't know where I'm going or what's happening, but we go up there and a C-section's just starting and... I'm guessing most people haven't seen a C-section before, but that shit's wild. And then...
Really?
Yeah. I mean, have you seen one?
Yeah.
They they cut open the belly, like rip through like different tissues, and then I don't know, maybe this one was just crazy, but they grab this baby's head and it's not coming out, just yanking on the neck. Just yanking, bro. They're like, turn it. Like it's like a fucking nut in a bolt or something. Like, turn it. Like, and it's just yanking on this newborn baby. Like, it's just crazy. And then they pull the baby out finally and bring it. And then Dr. G grabs it, pulls it over. She puts it down and then just goes, okay, it's your baby. Go ahead. And I'm like, what? She's like, it's your baby. Do what you gotta do. I'm like, oh, fuck. I have no idea. I just start rubbing it with the towel. This baby's just like, and then, I don't know, she kind of helps me out a little. I'm like, okay. And then I get in a groove, I'm rubbing it down. You have to, like, stimulate it. So it's just, it's like a premature baby. You're trying to, like, wake it up. You're, like, flicking its toes and stuff. That wasn't working. So then Dr. G just sticks a finger in its ass. I'm like, okay, well, that'll probably wake it up. Jesus Christ. And then she's like, okay, cut the umbilical cord. I'm like, what?
Was there no
She's like, clamp it. And I'm like, okay. The other two were like doing something else. And she's like, no, come right now. I'm like, okay. So I just sent him a text.
No, was there no OB students up there? Usually
no, yeah, there wasn't no B. Yeah, so we were peds just up there. But so then I like clamp an umbilical cord. I'm like nervous as fuck for some reason. And then I finally clamp it. And then, yeah, she's like, okay, here's the scissors. I'm like, oh, what the fuck? It's different. It's a different thing when you're actually doing it, But yeah, C-sections, I feel like I'd want to kill myself if I had to do C-sections like every fucking day. Oh yeah, for sure, if I was actually performing it.
OB has got to be like the most boring fucking field I've ever done.
I haven't done, that's the only rotation I haven't done as far as core.
Clinic is the only thing that's good about it, but L&D, dude, I wanted to kill myself.
What's L&D?
Labor and delivery. Women come in, give birth. If they can't give birth, do a C-section. That's it. It's so fucking boring, dude.
Yeah.
And one of the residents, we asked her, like, why'd you do OB? And she's like, oh, it's the most versatile. You get to do everything. I'm like, what the fuck are you talking about?
Explain.
Yeah, like, literally all you do is deliver babies, and then on the other side, you deal with, like, 1% of, like, all, like, conditions you could have, like, mostly STDs. That's it. And, like, fucking, contraceptives. That's
Bro,
it.
people's reasons for doing things are such bullshit most of the time. Like, especially if they're like their main career choice or something like that. Like, everyone lies to themselves, so they definitely can't give you a straight answer of why, Like, I have to check myself all the time, and even I fucking lie to myself a bunch of the time. So, like, I don't know. There's, like, no way that everyone else is fucking doing it. What they actually want to be doing or, like, should be doing or whatever, Yeah.
I'd much rather be in the fucking ring, dude, boxing it up.
Yeah, bro. Get me in there. I'll be your coach.
No, I'm just kidding. That's your thing.
I know it is. Every once in a while, I'm like a hankering, but I know I wouldn't like. I would like it, especially if it was great, but I wouldn't like. You would get sick of it just like everything else, to some extent, unless you just like love it.
Yeah, I would get sick of like fucking taking punches to the face.
To the fucking nose. Honestly, I wouldn't even get sick of that as much as just like training every single day. I think that would be annoying after a while.
Yeah, I don't know what I would do. Like,
because you have to keep up that same energy of when you were excited, oh, I want to get into boxing. You have to keep up that same energy every fucking day the rest of your career. Like,
and the shitty thing is it ends at like, 40 or whatever.
Yeah, right. And then you have to figure something else after. Which is nice that we're doing this. I'm like, look, this fucking sucks right now as far as some of it goes, especially basic sciences the last 2 years before this. But like, this is a lot of the things that you do in life, you start them, and if you don't like it, you should stop. But this, like, first of all, a lot of good things come out of it, money and all the other shit, and like fulfillment and blah, blah, blah. But studying is way different than when you're actually in it. Like, once you're in it, it's a whole different world than when you're studying for it. So, like, okay, you might hate studying, but I feel like you might be okay once you're in it, You might not be, which would fucking suck, but...
That's what my sister's going through right now.
Yeah.
She's not a student anymore, but... Oh, by the way, I was gonna go home for her wedding when she fucking, like, broke it off.
Who did?
My sister.
Your sister was gonna get married and then broke it off? What? Was this an arranged thing, or it was like...
No,
it was her true love?
It was, like, one of my friends, they, like, started talking, and she was like, okay, like, let's get married after, like, a year and a half or whatever.
Wait. Okay, you need to back up a little bit. They started talking and then they said, "Let's get married."
So
I have a different transit.
They've been dating for okay, let me explain it better. You said I was bad at explaining. Let me do a better job. They've been dating for 1.5 years. And in brown, culture, obviously, you gotta fucking get married soon. Otherwise, people are gonna talk.
Oh yeah, Ken is brown, by the way.
Yeah.
I'm white.
I think we've already discussed that.
Yeah, we know. I'm a white man. I'm a white woman, actually.
Cis, actually.
Yeah. Okay, continue.
So 1.5 years, they were talking. They're like, yeah, let's get married, whatever. So they're gonna get married in end of July. And I was gonna go back down for 2 or 3 weeks, for the wedding, and then just chill for a bit. But they just broke it off. Where was I going with this? I don't know. I guess I'll just tell
the story itself. But why?
Initially,
I have so many questions on it.
Initially, I start off because she was telling me about how nice it is to have the freedom. She fucking hated studying, in med school.
How old is your sister?
28. 28 in a month.
Right, and she likes it now, right?
Yeah. She's you have all the freedom, man. She makes a shitload of money, resident salary, but it's a lot for her because she lives at home and, only has to pay for her car. And, all this freedom and, all these benefits, so she's really loving it now. But, sorry, what was your questions?
I have so many. So, okay. First of all, that's dope that she actually likes it now.
Yeah.
What is her specialty?
Psych.
And I've heard that's one of the more you have more time for yourself type ones. So
I don't know about that because she kind of rotates through other specialties too. Because you have to spend time. She was in the EM for a while, and radiology and shit, and pediatrics. So she went through all of them, but what she does a lot is work in the clinic and then work at the hospital on the floor or whatever. I don't know if it's a floor or not. But a lot of times people come in with
so she's busy.
Episodes.
She's busy. Okay.
She's busy, but she gets
but she's still it's okay,
a
at
good
least it's not studying.
Yeah.
And then other questions. When people say, "Oh yeah, they're dating," it means everyone acts oh yeah, you know what I'm talking about, right? And it means different things for everybody. So what do you mean by she was dating him? They were hooking up? They were genuine, a normal relationship, a American relationship?
No, it's not normal. It's the Pakistani.
Okay, so that's way different.
Where you hang out, do stuff, but no intimacy.
No intimacy,
yeah.
That's the relationships I like. Zero intimacy.
Yeah, dude, and of course, you're staying virgin till marriage. Come on.
Has she genuinely never had sex before?
Well, I don't know.
As far as you know? Oh, you don't?
Yeah.
Oh, I talk to my brothers about crazy shit.
It's the culture is kind of more closed, so you don't really ask people that.
Yeah, but you could. It's your sister.
Could,
you're yo, sis, you had any abortions?
Let me tell you about the guy. The reason they broke it off. It was such a weird reason, dude.
Well, first tell me, how did they meet? Are they
He's my friend.
Oh.
He was my friend.
Oh, I think you told me about how they started talking.
Yeah.
Okay.
I probably have. But he was my friend. I guess I gotta fucking stop being friends with him now. But I didn't like it early in the relationship because I was this guy's being a bitch. He's not doing things the way I think should be done. So early on, he was very hesitant to put himself out there and not wanting to make himself vulnerable or whatever. And she's he doesn't really give me compliments. I was yeah, because he's a fucking bitch. He doesn't want to be put in that position where he's vulnerable and open. So I was really annoyed at that. And then he started getting better or whatever, and she's oh great. And then he got super comfortable because he wasn't putting in any effort. And then when my sister has an exam or something, she passed it, and he's oh, we should do something to celebrate. And then never brought it up again. Shit like that. He was always late, dude. I was there during Corona time, and he I was about to leave and come to New York, and he's hey, we should all do a dinner. And we got there, he showed up 25 minutes late, and I was so pissed. I was this guy fucking wants to set up a dinner.
Did he come in and like, yo,
No.
I apologize.
No.
Vigorously, like, no?
No, and I called him out. I was like, bro, why are you 25 minutes late? He's like, man, this is just the way I am. And I was so fucking annoyed.
Like, that makes it worse.
I know. he just doesn't get it. He's like, I'm like, why couldn't you change the time? Because he was like, I got off work, I went home, I showered, and, you know, did some shit and came. I was like, why couldn't you just change it later? Like, it's not like we're doing anything.
Right.
So I was really annoyed at that. And he was just always late to everything, you know, like he forgot everything. Like his family was having like a movie night and his brother was like, oh, you should invite like, you know, Ken's sister. And he was like, didn't invite her because he forgot. And like,
This guy sounds like the biggest dingus in the world.
yeah, he kind of is, honestly. And then he has like some insecurities or something because he kept saying like, oh, you know, I don't know if I'll be able to keep you happy and shit.
What?
And he
He's got
has
a small dick, is that what he's saying?
very high aspirations, like very,
Oh.
very high. He wants to be an investment banker,
Okay.
like for funds that manage like millions of dollars.
Okay.
But right now, what he does is a bank teller.
Oh,
And
he's got
so
a long bridge
from
to gap, my
there
guy.
to there, yeah, from like step one basically.
Boy's
to,
got to
like,
build the Golden Gate Bridge.
from the fucking river up.
yeah. Yeah, some treacherous waters, too. And you do not have a good start.
Yeah.
You got a couple bricks and a couple twigs.
Yeah. So my sister, you know, obviously is going to be making a lot more money in like next few years. And I think he was insecure about that. He wanted to be the breadwinner. And so the first time they had like a big argument and then they worked it out and he's like, yeah, you know, I'll do better, you know, I'll communicate more. And then like a few months later, it's the same shit. He's like, you know, it's like 2 months from the wedding and he's like, oh, I don't know if I'll be able to keep you happy, you know, blah, blah, blah. I don't remember what the other shit was. He wasn't really saying what he was feeling, you know?
Yeah.
So my dad went over and he's like talking to him and he's like, basically, like, what are you gonna do if you're feeling this, like, this now when, like, you know, she's gonna be making, like, you know, $300,000 a year
Yeah.
in, like, 3 years. 3 years from now, and he's like, are you still gonna compare yourself? And he's like, I'll make more than that. And I'm like, what the fuck is that kind of answer? Like, wouldn't you just say, oh, that's great for her and I'll be doing my own thing?
This guy sounds kind of goofy.
Yeah,
Pretty insecure.
dude, I told her fucking day one, don't.
Yeah, this
like,
ain't it.
it's not right. Like, he was fine to hang out with.
Yeah.
Here's what he was fine for. He was fine to play ping pong with
Yeah.
in my basement.
There's a difference between your stoner friends and people that should date your sister. That's for sure.
There's, you know, he was good for that, but as a fucking, you know,
All right, this is
brother-in-law,
you
no.
guys heard it here first, folks. If you want to date Ken's sister, you need to have less insecurities.
Yeah.
You need to make over $300,000 a year. And you need to say what you feel.
Yeah, but it's weird. Like, his family dynamic is kind of weird too, because he's the oldest brother, but his younger brother gets like more respect than him. He's like a dentist, and his younger brother's already married, and he's more successful with chicks, even though his younger brother is like.
But
fucking...
this guy's gonna be an investment banker.
yeah, dude. Hopefully one day. His younger brother is like fucking, you know, Sasquatch. He's so fucking hairy, dude. It's crazy.
Oh.
His head hair is like his leg hair, you know. It's just,
Oh yeah, one of those.
Yeah.
He's got it throughout his body.
dude.
He's got to put a deodorant on his arms.
My leg hair, like this kind of hair, like coarse and like long, is like his hair up here. Like, it's really bad.
Yeah, you need kind of a visual aspect for that one.
You know, that's what the
It's
fucking
too
thing
bad.
would have been
I
perfect
know.
for.
It's unfortunate.
Um,
If you know any animators, let us know.
yeah, but like his brother like gets all the like respect, and so he's more of like already been like put in second place, even though he should have been like, you know.
There's still time.
I
There's
know,
still
dude.
time,
There's
bro.
always time.
Just becoming an investment banker. And that's not it, but and not be insecure, you know,
Yeah.
soft-spoken dingus.
He's not soft spoken, and he's assertive, but he just
Doesn't actually say how he feels and stuff. He
Yeah.
can't be vulnerable on his own.
he's assertive when it comes to guys, but for girls, he's like, you know, doesn't want to be vulnerable and shit. So I don't know.
There's a lot of guys that are like that. Like, they're like, assertive to guys, but then they can't be vulnerable, like emotionally or like you know,
it's kind of sad. Honestly.
or put themselves out there with girls or anything. Like their ego is just too wrapped up in it.
Yeah.
Fuck, I used to be like that.
You still are, dude.
Fuck.
So my sister like thought about it for like, you know, a couple of days, and she's like, yeah, I don't want to do this because what if it happens again? You know, you're not telling me how you really feel.
Yeah.
All this still is just like,
so
you know,
weird.
our
Such a weird situation.
our assessment. He still hasn't said anything was wrong, which is like so insulting. You know, you're being so different. You're saying all this shit, but you're not telling us what's up. And it was really annoying.
I don't think I can keep you happy. Like, what a fucking... I like how he sabotaged himself in this, too. All he had to do was just not say anything.
Yeah, exactly.
Fine.
Like, he could
So
live off her
weird.
money for the rest of her life.
Yeah.
Or his life, if he wanted.
He's not even a good loser. He's not even good at being a loser.
He left, like, a fucking money-making machine.
Yeah.
It's
And not even money, but he would, like, you know, have a wife and stuff.
Yeah.
If he's not good with girls, like...
Yeah.
Then he's, like, doubly set. But he, like, sabotaged himself. He put a stick in his own spokes. Like,
I don't think he's fucking good with girls. He never really like tried. But yeah, that's basically the story. So I was gonna go home for that, but I ended up. I'm still keeping the flight. I'm just gonna fucking go home.
don't you have to do some visa shit anyway, since you're Canadian?
Not until January, but I'm gonna go home and just chill with my friends. You know, maybe go to the mountains. We'll see what happens. It's gonna be nice, dude, because I'm fucking so sick of studying. I haven't been able to focus for like 2 days.
Really?
Yeah.
Why?
I'm
What's
just
on your mind?
tired, man. I'm just exhausted. Like, I've been taking naps at like 3 p.m.
Oh,
but they're not like
right.
naps. They're like, I'm
Sleeps.
about to fall asleep.
Yeah.
dude.
Bro, I know that feeling.
It was happening at SGU. I don't know if you remember, but end of term 4, like, I would go to lecture, I would go to small group, go home, fall asleep at like 5 p.m.
Damn.
And I would wake up the next day.
Damn, what?
Yeah. This is for like, you know, 2 weeks.
Okay, I was doing that too, but I did it with the mindset of, alright, whenever I wake up, I'm gonna start grinding again. So I'd wake up at fucking 3 a.m., you know, but then I'm like, alright, study time, you know?
Yeah.
Do my, like, push-ups or whatever the hell I was doing at the time, and then... like, go do 100 push-ups, and then...
My knee push-ups.
yeah. And then just get to it, you know? It's like 3 a.m., but, you know, you just do it whenever you feel good enough to do it.
Yeah, but it wasn't even that. It was like...
You were, like,
complete exhaustion. Like, I would be falling asleep in small group. It was so bad. And then I wouldn't even, like, wake up at 3 a.m. I'd wake up at, like, 8 a.m. Like, more than 12 hours still sleep, and I'd still be tired. And I thought I was, like... I don't even know, man. I thought I was depressed and shit. It was crazy. And I told my cousin, he's, like, the internal medicine guy. And he's like, do ciggy caps on yourself, but it wasn't enough. I only had, like, the sleep. And then I thought I had mono and shit, but then...
I love how the internal medicine guy, I mean, any doctor is like, yeah, it's like, hey, you know, my cousin, you know, I'm coming to you with this really important, like, how I feel and stuff. And they're like, yeah, do this mnemonic on yourself. Figure, you know, diagnose yourself with depression or not. That's the worst. What the fuck?
It worked though. It was good.
That, I mean, it honestly is to some extent, because it's like, look, prove to yourself that you're not depressed by doing this, or prove to yourself that you are by doing it. But it's just, that's hilarious. Like,
he gave me some good differential, but I thought I had an infection or something. That was like, but I don't know. It was just literally, I was just exhausted, and the same thing's happening now. I already took my nap, luckily today, so I'm okay for now. Plus, I'm gonna make tea after this and just go like ham, go study, do something else.
Nice. Well, I've been going off, so in other words, honestly, yeah, I've been feeling great lately. But
here's the thing,
I've been studying hard.
You have one hobby, which is getting chicks, and as long as you can do that, like it's like balance.
Well, bro, but here's the thing: it doesn't have to be like that. I used to have a bunch of hobbies, but I simplified it. That's my point. People are doing way too much. There's so many opportunities now, and that's great. But if you fucking try to do everything, you exhaust yourself and you feel shitty. But if you just simplify, try to be good at a couple things, and be like, yo, this is what makes me happy, and do the things that you like, regardless of what other people say, then I think you're way better off. You know, I try to only do a few things. It's not like that just because that's how it is. It's like that because I make it like that.
Yeah, but the other thing is, like, it's also personality-wise, like,
yeah.
I know our fucking Isaiah, our roommate, like, loves to party, but I don't want to party. I just want to chill with my friends for a little
Same.
bit.
Same.
And I don't really get that here. Like, I don't have enough time to do that. And like game nights and stuff are fun. But I need more of that. I need like 2 or 3 days of just like chilling and doing nothing to like get back to baseline.
Yeah.
Which is why I'm like
Just basic sciences and clinicals. You just don't have that kind of opportunity a lot of the time.
But that's why I'm like psyched to go home. So I can finally like just take a rest for like a couple of weeks and not have to like study and shit. But it'll be really nice just to like be done with step 2 and just have nothing to study for besides the OET, I guess.
Oh,
that's
yeah, for sure.
easy.
I think our lives will be very different after step 2, which is like our big test. So, I mean, our whole lives right now are based on studying for it. So that was same with step 1. But I mean, step 2, there's not really, there's a step 3, but it's not a big deal. Is the thing.
Yeah. How's your mental health?
I love how you just incorporate that sometimes. Just like there was a month like a year ago where you're like, hey, so how's your mental health? Just like every once in a while, it's like, are you like interrogating me? Are you a cop?
I'm just trying to look out, man.
No, I know. I get the motivation behind it now. It's good, man. I've been chilling lately, and I would tell you if it was shitty. It's been great.
You were at the low.
I've been very lucky. Yeah, man. After surgery, rotation, I was real low. I was real low. But I've been chilling lately, man. I've been real good. So just be better, everybody. If you're sad, just do good.
Yeah, and I don't think I'm like mental health is bad, but I think I'm just tired.
Yeah, that's part of it too, man. Although, no,
it takes a lot, and like especially if you don't like what you're doing, like I don't like ER, so
it makes it tough, man. It really does.
Like I don't like that environment, and I have to go there for 4 days a week. But I fucking love the IM environment.
Yeah,
just chilling, looking.
And I could tell, man, you were definitely feeling good when you were in IM. So
yeah, and the attendings were sick. Here, the attendings like don't really say anything.
Yeah, it depends, and it's kind of like a rough love relationship with the attendings in the ER, which I loved it because honestly, that's how I like grew up. I was like, parents, like, show me fucking attention. It's like only if you do great things they go, oh, that's really cool, and then you go, yes, I'm fulfilled. I need to do more great things. But yeah, that's how they are, and they'll give you like a second of attention if you do something great or shitty, and they'll be like, that was shitty, or like that was good,
Yeah,
but
they've been all pretty good so far. Like the residents.
Yeah, they're all cool though. Like they're not like bad or annoying or real. They're different personalities, but like I didn't have the vibe from very many of them that they were like annoying or shitty, or like didn't get the job done.
You said there was one attending that was like, everything you did was wrong.
There was like, the bald white guy.
Okay, I haven't seen him yet.
Oh, really? Okay.
I thought you were talking about another one. There's like this tall, skinny black guy.
Oh, that was the resident.
He's an attending.
He's an attending?
Well, I think there's a tall, skinny black resident, but there's also a tall, skinny black attending.
Oh, I don't know who that is.
Okay, his initials are KG. If that makes any difference. Mm-hmm. He seemed like he'd be a hard ass, but he was pretty nice when I was like doing my presentation.
You have to tell me who it is after, because I'm interested. Oh.
Do it here. 1 hour, 2 minutes. Fuck, it's already been an hour, dude. Damn. Alright.
Shit, we actually have to stop it because I only have the, we might even have to cut some of this. Damn. But okay, I'll look them up later. But alright, that was a good podcast.
Yeah.
We just rolled. We never had a moment where we sold.
Alright.
Alright, until next time.
Yeah.
Thanks for tuning in.